Serikali Isaac Mwaura amewaahidi Wakenya kwamba mpango wa huduma za afya utamuezesha Mkenya wa kawaida kupata huduma za afya kwa bei ya chini. Mwaura amepongeza uamuzi wa mahakama kuwatoza Wakenya fedha za matibabu, akisema kwamba Wakenya wengi watafaidika. Kadhalika amepuuzilia mbali kauli ya shirika la waajiri FKE ya kushinikiza serikali kuwafinyilia Wakenya kuwatoza matozo ya 1.5%. Kesho mahakama inatarajiwa kutoa uamuzi wake.
Under the Ministry of Health, now this is very, very important. We want to update us on what we've done so far, and later on we are going to have another evaluation of the Ministry of Health at Cambridge at 1 o'clock. The Social Health Insurance Fund is a stride towards achieving a more inclusive and accessible healthcare system in Kenya. And we are very happy because the orders were lifted, because what was happening before is a fact that we didn't have any form of insurance in the ensuing period, because the National Health Insurance Fund Act had already been repealed, and so there was a lacuna because there was no law in operation. So this is very, very commendable, and we must really commend the Court of Appeal for doing so. However, contrary to popular opinion, really, about the new charges, 54% of Kenyan hustlers will benefit from reduced NHIF contributions, resulting in enhanced affordability for essential healthcare services. This is a fact that the contribution per month is being reduced from 500 to 300. That is a clear reduction of 40% of the cost. Similarly, the Act ensures fairness by introducing a modest 2.2 upward adjustment for 46% of the contributors. Let me explain this very clearly. If you reduce, and that is what is going to happen, is already happening actually because the Act is in place, you are going to have more hustlers paying 300 rather than 500. And then you are going to get more people able to pay into the Social Health Insurance Fund. A reduction of monthly contribution by 40%, by the lowest tier of people who are at the bottom, is really an enactment of the Universal Health Coverage Program under the plan that is envisaged in our manifesto. And also further to that, 54% of any other contributor from 300 upwards are going to benefit from a reduced amount of money. So they are going to gain. This is because 3/4 of Kenyans earn 50,000 shillings and below. So they actually benefit more. It's only 46% of Kenyans who are going to have a marginal increase by 2.2% on average, all of them combined. But then the people who, the other equity issue that has been happening that we need to emphasize under this fund is that people are paying 500 up to a maximum of 1,700. And so if you pay the same amount at a minimum wage, the people who are earning the lowest because of their basic pay were paying up to 5% of their income, 5%. Yet somebody who is earning 1 million shillings was only paying 1,700 shillings, which is equal to 0.0017% of their salary.